Welcome to our deep dive into laser trabeculoplasty. Seems like lately everyone's talking about lasers and how they can help protect your vision.
Yeah, it is remarkable how this technology's come so far, you know? I mean, we're
Yeah.
talking about using focused light to actually reshape structures inside your eye.
Okay, so let's break it down a little. Glaucoma, I know, is a serious eye condition,
Yeah.
but remind me, what's the connection between this procedure and actually protecting our sight?
So it all comes down to pressure, specifically the pressure inside your eye, intraocular pressure. And in open-angle glaucoma, the most common type, the eye's drainage system gets clogged.
Oh,
It's like, a slow drain in your sink. That fluid builds up and the pressure starts to rise.
right.
Now imagine that happening inside your eye.
Yeah.
So that increased pressure puts a lot of stress on the optic nerve,
All right.
which is what carries all that visual information from your eye to your brain.
That makes sense. So that's where vision loss comes in.
Exactly. If that pressure stays high, it damages the optic nerve and can lead to irreversible vision loss and even blindness.
Wow. Okay, so this is definitely not something to mess around with.
No.
So how does laser trabeculoplasty address this drainage problem?
So think of it like this. Instead of a plumber's snake, we're using a highly focused laser beam
Okay.
in SLT, which stands for Selective Laser Trabeculoplasty.
Yeah.
The laser targets the trabecular meshwork. That's like a filter in the eye's drainage system.
So the laser is kind of clearing out the clog?
Well, not exactly clearing it out, more like stimulating it.
Right.
The laser energy causes a series of very precise, localized reactions in the trabecular meshwork, and that helps improve the flow of fluid out of the eye, and as a result, that intraocular pressure goes down.
It's fascinating that they can do all that with a laser.
Yeah.
So why is FLT the go-to type of laser trabeculoplasty?
Well, it has a lot to do with precision and minimizing damage. The type of laser used in SLT, a YA laser, is incredibly precise. It creates these tiny, targeted spots of energy and leaves the surrounding tissue virtually untouched. So this is a big deal because it means less inflammation, faster healing, and a lower risk of complications.
Okay, so it's like a microscopic scalpel making these very specific adjustments to improve drainage.
Exactly.
That's incredible. But I'm curious, who exactly is a good candidate for this procedure?
SLT is typically recommended for people with primary or secondary open-angle glaucoma who need help controlling their intraocular pressure.
So basically anyone whose glaucoma isn't responding well to other treatments.
That's a big part of it. Sometimes medications alone just aren't enough to lower the pressure sufficiently, or you might have patients who have difficulty sticking to, a daily eye drop regimen.
Yeah, I can imagine it's a hassle juggling all those different drops, especially for people who are already busy or have other health issues going on.
Yeah,
So SLT could be a game changer for them.
absolutely. SLT can offer more sustained pressure control,
Right,
reducing the reliance on medications and simplifying their daily routine.
right.
It's a real win-win for both the patient and their doctor.
That's incredible.
Yeah.
It's amazing how this technology is creating new possibilities for people managing glaucoma.
Yeah.
So if someone is considering SLT, what can they actually expect during the procedure itself?
Well, first off, it's surprisingly quick and painless.
Yeah.
The whole thing takes about 10 to 15 minutes, and it's done right in the ophthalmologist's office.
Okay.
And you'll get numbing eye drops beforehand, so you shouldn't feel any discomfort during the laser application.
Okay, that's reassuring.
Yeah.
But can you walk me through, like, the actual steps involved? What happens once you're, like, in the chair?
Sure. So before the procedure starts, you'll get detailed instructions from your doctor, which might include adjusting your current medications or avoiding contact lenses for a certain period.
Yeah.
And once you're in the treatment room, the doctor will put in those numbing eye drops and may place a special contact lens on your eye to help focus the laser.
So you're wide awake throughout the procedure.
You are, and you might hear a gentle clicking sound as the laser is applied, but it's really nothing to worry about.
I know some people might find that a little unnerving.
Yeah.
It's always helpful to know what to expect beforehand so there are no surprises.
Exactly. The more informed you are, the more relaxed and comfortable you'll feel.
Right.
So after the laser treatment, the doctor will check your eye pressure and give you detailed instructions for post-op care.
And what does recovery look like? Are we talking about weeks of downtime?
Not at all. Most people experience minimal downtime and can resume their normal activities within a day or two. You'll likely need to use some medicated eye drops for a short period to help with any inflammation.
So it's a relatively low-impact procedure overall. What are the long-term results? Like, how long does this pressure reduction actually last?
Well, it really varies from person to person. For some, the effects of SLT can last for several years, while others might need a repeat procedure sooner.
Right.
The important thing to remember is that even if the effects do wear off, SLT can often be repeated safely.
Okay.
So it's not a one-time fix, but it offers valuable flexibility in managing glaucoma over the long term.
Yeah, it sounds like a significant step forward compared to like relying solely on medications.
It definitely provides more options and allows for a more personalized approach to treatment.
Right.
Now, it's important to note that SLT isn't a cure for glaucoma.
Right. It's not a magic bullet, but it can be a powerful tool for slowing the progression of the disease.
Hmm.
And that's the ultimate goal, to preserve vision for as long as possible.
Exactly. And that's why it's so important to work closely with your eye doctor to determine the best course of treatment for your individual needs and circumstances.
Right.
SLT is a remarkable option, but it's not the only one.
Okay, so let's talk about some of those other options. What are some of the alternatives to SLT that people might consider?
Well, medications are still a cornerstone of glaucoma treatment. There's a whole array of eye drops out there, each designed to tackle that pressure buildup in a slightly different way.
So it's not just a matter of picking up any old bottle of eye drops. There's actually a lot of nuance to choosing the right medication.
Absolutely. It's a bit like finding the right key for a specific lock. Your doctor will consider several factors like the severity of your glaucoma, your overall health, even your lifestyle, when selecting the best medication for you.
Makes sense. I imagine some people might need a combination of different eye drops to get the desired results.
You're exactly right. It often takes a bit of trial and error to find the perfect cocktail of medications that controls the pressure without causing those unwanted side effects.
It sounds like a real balancing act. So besides medications, what other alternatives are out there?
We've talked about SLT, which is a type of laser trabeculoplasty, but there are a couple of other laser procedures that might be suitable depending on the situation.
Okay, I'm all ears. Tell me more about these other laser options.
One is called Argon Laser Trabeculoplasty, or ALT for short. It's been around for quite a while and uses a different type of laser than SLT.
Okay.
Think of it as using a broader brushstroke, if you will.
So a less targeted approach.
Exactly. While ALT can be effective in lowering pressure, it tends to cause more inflammation and scarring in the treated area compared to SLT. That's why SLT is often preferred, especially for younger patients or those who might need repeat procedures down the line.
It's like choosing between a fine-tipped pen and a thick marker. Sometimes you need that precision to get the best results.
Right.
So what's the other laser procedure you mentioned?
It's called Micropulse Laser Trabeculoplasty, or MLT. It's a relatively new kid on the block and uses an even more gentle approach than SLT. Imagine a laser that delivers its energy in tiny, rapid pulses, almost like a gentle tapping sensation.
So even less disruption to the eye's delicate tissues.
Precisely. MLT is showing great promise in terms of safety and effectiveness, but it's still early days. We need more long-term data to see how it stacks up against SLT in the long run.
It's exciting to see how technology keeps evolving and offering new possibilities for treating glaucoma. You also mentioned laser iridotomy earlier. How does that one fit into the picture?
Laser iridotomy is a completely different approach. It's not about unclogging the drainage system, but rather creating an alternate route for the fluid to escape.
Okay, now you've got me intrigued. How does that work?
Imagine you have a traffic jam on a highway.
Uh,
Instead of trying to clear the existing lanes, you create a bypass route to alleviate the congestion. That's essentially what laser iridotomy does. It uses a laser to create a tiny hole in the iris, the colored part of your eye, allowing fluid to bypass the clogged drainage angle.
so it's like creating a pressure relief valve in the eye.
That's a great analogy. And it's particularly effective for a specific type of glaucoma called narrow-angle glaucoma, where the drainage angle is physically blocked.
It's amazing how each procedure has its own unique mechanism and targets a specific aspect of that drainage system. So we've talked about medications, various laser treatments, but you also mentioned surgery as a last resort. When would that typically be considered?
Surgery is usually reserved for cases where other treatments haven't been successful in controlling the pressure. It's a more invasive option, but it can be very effective.
What exactly does this surgery involve?
The most common surgical procedure for glaucoma is called trabeculectomy. It involves creating a new drainage channel in the eye to allow fluid to escape more easily.
So it's like creating a whole new exit route for the fluid.
Exactly. It's a more complex procedure than laser treatments, but it can provide long-lasting pressure control for patients who haven't responded to other therapies.
It's incredible to see how many different approaches there are for tackling glaucoma.
Yeah.
But with all these options, how do doctors and patients decide which one is the right fit?
That's where careful evaluation and open communication come in. The best treatment plan is always tailored to the individual patient, taking into account their specific type of glaucoma, the severity of their condition, their overall health, and their personal preferences.
It's not just about the science, it's about finding the solution that aligns with the patient's needs and lifestyle.
Precisely. And that's why building a strong doctor-patient relationship is so crucial. Open and honest discussions, clear explanations, and a willingness to explore different options together are key to finding the best path forward.
So it's a collaborative effort where both the doctor's expertise and the patient's input play a vital role.
Absolutely.
Now, I know we've been focusing on the positive aspects of these treatments, but it's important to acknowledge that every procedure comes with potential risks and side effects.
Of course.
What are some of the things people should be aware of?
You're absolutely right. No medical intervention is entirely risk-free.
Right.
Even SLT, which is considered a very safe and effective procedure, has potential downsides that we need to discuss.
Okay, let's dive into that then. What are some of the things that people should be aware of?
Well, with SLT, the good news is that serious side effects are quite rare. Most people experience mild, temporary discomfort, like blurry vision, redness, or a gritty sensation in the eye.
Okay.
These usually subside within a day or two.
So, pretty typical after effects you might expect with any kind of eye procedures, or anything more serious to be aware of?
While rare, there's a slight chance of developing elevated eye pressure after SLT.
Oh.
It's a bit ironic, considering the goal is to lower pressure, but it can happen as a temporary reaction to the laser treatment.
That does seem a little counterintuitive.
Yeah.
How is that managed?
Your doctor will monitor your eye pressure very closely after the procedure. If there's a significant spike, they can usually control it with medication.
Okay.
In most cases, it's a short-lived issue that resolves pretty quickly.
Good to know. Anything else that falls into that rare but serious category?
There's a condition called peripheral anterior synechia, which is a fancy way of saying that part of the iris can stick to the cornea.
It sounds a bit like when you try to peel apart two pieces of bread that have gotten stuck together with jam.
Exactly. And just like that sticky situation, this can interfere with the fluid drainage and potentially lead to complications.
Okay.
Again, it's not common with SLT, but it's something to be aware of.
So it's all about staying vigilant and reporting any unusual symptoms to your doctor after the procedure.
Absolutely. If you experience any sudden vision changes, severe pain, or persistent discomfort, don't hesitate to reach out to your doctor right away.
Right.
It's always better to err on the side of caution.
I think that's great advice for any medical procedure, really.
Yeah.
Now, I know we've covered a lot of ground today, but before we wrap up, I want to kind of circle back to the big picture here.
Sure.
Why is SLT considered such a game changer in the world of glaucoma treatment?
Well, I think it boils down to a few key factors. First and foremost, it's a minimally invasive procedure with a relatively quick recovery time.
Okay.
Compared to traditional surgery, SLT offers a much gentler approach with fewer risks and a faster return to normal life.
So less downtime and less disruption overall.
Exactly. And then there's the fact that SLT is often repeatable. If the effects wear off after a few years, which is common with any glaucoma treatment, you can often repeat the procedure without significant risk. This provides a valuable long-term solution for managing the disease and preserving vision.
That repeatability aspect is huge. It really shifts the paradigm from a one-time fix to a more sustainable, long-term approach to managing glaucoma.
Precisely.
And finally, there's the effectiveness. While no treatment works for everyone, SLT has a solid track record of successfully lowering eye pressure and slowing the progression of glaucoma. So it's a combination of safety, convenience, and proven results that makes SLT such a compelling option for both doctors and patients.
Absolutely. It's not a cure, but it's a powerful tool in our arsenal for fighting this sight-stealing disease.
Well, I think you've given our listeners a truly comprehensive deep dive into laser trabeculoplasty. From understanding the basics of glaucoma to exploring the various treatment options and weighing those risks and benefits, I think we've covered it all.
I hope so.
Any final thoughts you'd like to leave our listeners with?
I just reiterate the importance of early detection and proactive management.
Okay.
If you have any concerns about your eye health, or if you have a family history of glaucoma, don't hesitate to schedule an appointment with an eye doctor.
Right.
Early intervention is key to preserving vision.
Couldn't agree more. Knowledge is power, and understanding your options empowers you to make informed decisions about your health.
And remember, you're not alone in this journey. There are dedicated professionals and support systems available to help you navigate the challenges of glaucoma and maintain your quality of life.
Thank you for joining us on this deep dive into laser trabeculoplasty. We hope you found it insightful and empowering.
Stay curious, keep learning, and keep those eyes healthy.